Yo, good morning, Freedom Marchers. Good morning, good afternoon, good evening, wherever you're at in the world. This is Tyrus Bain. Welcome to the Definition of Anarchy channel, where today on December 22nd, 2021, I am going to be discussing Joey B's address to the nation yesterday, where he had some dire warnings for the un-vacillated, the unsnapped, the non-GMO folks in this country. Well, you know, oh man, what great leadership this guy displays, huh? What great leadership. What a way to encourage people to go out and get that Vaseline. By telling people that they're going to be dying, or it's going to be a winter of death. It's going to be a very, very miserable winter of death for the unsnapped. So go out and get Vaseline. Go get Vaseline. What are you waiting on? You know how he does his creepy whisper shit? You know what I'm saying? Like, I don't understand how people voted for this dude, right? Now, y'all know I don't vote for nobody, right? When you cast a vote for anything in this system, you are letting the system know that you are submitting your will to them and that they have, the right to rule over you, right? That's what you're doing. You're saying, look, I want you to do this, right? When you vote, you're saying, I want you to do this. This is what I would like to happen. But if it doesn't, I'll roll with it anyway. That's what you're doing. You're submitting to whatever decisions are made, whatever comes down. So I don't understand how people voted for this dude. He is a clear clown shoe. But we know that was more like people were voting against Donald Trump. But this guy gets up here, oh man, tells tens of millions of people that aren't snapped, that are non-GMO, that they are going to die, right? Or you're going to die. It's going to be a long, sufferable winter for you, and you're going to die. But we don't want to talk about the people who passed away after getting the Vaseline. We don't want to talk about the GMO people that died. No one wants to talk about that. And then he uses the Omicron, the Omega variant. The Omega variant, that's what he uses to push this fear campaign. He uses that to push his fear campaign. And when they ask him, yo, is this something to worry about? Is the Omega variant something for us to worry about? And he says, well, if you're un-Vaseline, then yeah. You know, if you're non-GMO, then yeah, you're gonna die. You know what I'm saying? You're gonna die a miserable death, and you're gonna kill your family members, and you're gonna kill everybody, including the GMO people. You know, like, how many more ways can he try to vilify people who want to have medical autonomy? How many more ways can he do it? He's supposed to be the leader of the free world. He's supposed to be the leader of everyone, right? He's supposed to represent. He's the executive of everybody in this country, including the non-GMO people. But he wants to push this one-size-fits-all medical treatment on everyone. Why? Why are they so desperate to do this? Data coming out of South Africa, data coming out of the UK shows that the Omega variant is the variant that could probably end this pandemic. They're saying, with so many experts, if you just take time to look and research and do what you got to do your due diligence and find out what's really going on. Look at what's going on in South Africa. In South Africa, the Omega variant has been around for like 6 weeks. And there's no indication that is going to be worse than what it is. And as it stands right now, the Omega variant in South Africa is mild as shit. It's like the common cold, maybe a little bit like the flu if you get the body aches and whatnot and the fever, right? Just based on the symptoms that occur due to it. But, you know, in the UK and in the United States, they're acting like this thing is another, they're acting like it's Ebola. They're acting like this is Ebola. But if you listen to the South African president, he was like, man, ain't nobody tripping on this shit. He basically told the truth. Like, we're not going to bug out over this. We're not going to do no lockdowns. We're not going to do any forced snap-a-leans and nothing like that. No snap scenes, nothing like that. We're not doing that. We're going to live healthy, be healthy, take care of your body, take care of yourself. That's basically what he said about the Omega variant, right? Oh, but it transmits so quickly and transmits so fast and spreads. Well, that's because it's weak as fuck. It doesn't hold on that well to the tissue or to the whatever the fuck that it is supposed to be holding on to, right? Now, one doctor, Dr. John Campbell, if you guys want to look him up, look up Dr. John Campbell. He explains why the Omega variant is not nearly as deadly, not nearly as severe as maybe like the Delta, the wild type, and, you know, the Beta, whatever the fuck. It's because the Omega variant does not typically get down into the lung tissue, right? It kind of like it reproduces in the bronchi of your chest. That's like right before it gets into the lungs. That's where it sticks. It sticks and reproduces in the bronchial tubes of your lungs, right before it gets into your lungs. That's where it reproduces, and so yeah, it's going to be more easily spread because it's not deep down in you. It's not as deep down. It's not deep down in your lung tissue, so it's more likely to cause bronchitis than pneumonia. Okay, and so what happens is with previous variants, so they say, the previous variants will get all up in your alveoli and all this other shit in the little sacs right before, you know, where your oxygen goes into your bloodstream. That's where it goes, and it fills up with fluid. That's how people were dying, right? That's how people were dying so much. That's why people were ended up on ventilators. That's why people had such severe illness. But with the Omega, it does not get down there. It stays in your bronchial tubes, and that's where it reproduces. And it reproduces in the sheds much more easily because it's closer to your windpipe, which helps it expel out of your body. So that's what happens. It's not as deadly. It doesn't attach to as many cells as the other variants because the way it mutated, that's what happened. You have to understand, right? According to the germ theory, right? According to germ theory, these things want to spread, right? They want to spread as far as possible. So what they're evolving to do is not necessarily kill you, but to spread, because they want to spread their population. Now, I don't understand how this could happen with a virus, because a virus is not a living thing. It's like a machine, which, you know, it doesn't explain how. There's no explanation of how viruses have instincts and desires to do whatever. But this is what they're saying. It wants to spread, so when it mutates, so that it could spread more, not so that it could not spread and not be able to shed, right? So that's what's happening. That's what happened. Every time it mutates, it becomes less and less deadly, less and less less and less severe, because it wants to spread as many people as possible. So they say. So every time you have a new variant, it's not going to be as deadly as the one previous. It's not going to be as severe as the one previous. And so now they're saying we're like, this thing spreads so fast and so easily. Way more people have it than are, there's way more infections than there are cases. Way more infections than there are cases. Cases are confirmed positive tests from individuals that go to the hospital, that, you know what I'm saying, that take tests, that take tests outside of the hospital. The number of cases are always going to be much smaller than the number of infections, because people who are infected and don't know they're infected, well, they're not going to get tested. They don't have a reason to, unless they're going through mandatory test bullshit. So they're not symptomatic. They're not asymptomatic, or they have very mild symptoms, so they just dismiss it. So that's how it spreads easily, because people are asymptomatic and they're spreading this thing, and we're essentially very close to reaching herd immunity, right? And this is what I'm just telling you guys what the doctors, multiple doctors and scientists are saying, right? That's all I'm doing. I'm not giving medical information. I'm just telling you, I'm conveying what I heard and what I learned from other experts, And so what about the hospitalizations? Well, half of the hospitalizations, roughly, are, half of the hospitalizations are for people who were hospitalized for something other than the Modelo 19. They just had to get tested. So the positive results were incidental. So they weren't in there because they were suffering from Modelo 19. Oh my God, no. They're in there for another reason. Maybe some type of surgery. Maybe, you know what I'm saying? Maybe a broken arm. Maybe a gunshot. And they just happened to test positive for the oh my God, for the Modelo 19. And so they have to be classified as a Modelo 19 hospitalization. And this is what they're doing with the numbers all over the world. They're doing this in the United States. People end up in the hospital for whatever reason outside of Modelo 19. They get tested. Oh, you have Modelo 19. So now you're a Modelo 19 hospitalization. This is how they're able to say, oh, well, the Modelo 19 un-GMO people, the non-GMO people are overwhelming the hospital with their Modelo 19, when half of them weren't in there for that. You know what I'm saying? They sit over here talking about, oh, Modelo 19 patients that are non-GMO, they're taking up hospital beds, and people with heart problems can't get in there. Well, guess what? Some of these so-called Modelo 19 patients are actually there, some of them, for heart problems. So their heart problems aren't important when they're showing up for their heart problems, for their lung problems, because they've already had these problems. They had these comorbidities before they had Modelo 19. Because they're non-GMO, their fucking things aren't important. Their health isn't important because we refuse to get this medical treatment. Get the fuck out of here. So here we have Joey B trying to scare the pants off of the non-GMO people. I'm going to tell you something, Mr. Joey B. If people aren't convinced enough right now to get the Modelo 19 hokey pokey, they're not going to be convinced after you tell them they're going to fucking die because you won't do what I say. Joey B is a piece of trash, okay? I don't care if he's a puppet right now. I don't care if he's old and senile. and is just doing what he's told. He's been a piece of shit. He's been that way for 40 fucking years in this government as a senator. You know what I'm saying? And as a vice president, he's always been a piece of shit. So that's from your boy Joey B. Someone sitting up here coughing and hacking on the fucking microphone in a room full of people. You know what I'm saying? But we the problem. What you sitting up here hacking and coughing for? And then, you know, just to touch on all these clowns, these celebrities and these politicians that have been pushing the snap all this time, trying to make people feel bad for not wanting to get it. They done got their second and third, fifth and 30,000 booster. And they sit up here sick with the Modelo 19. Modelo 19. You know what I'm saying? Oh, and Cory Booker, old stupid ass. Oh, if it wasn't Cory Booker, okay, Cory Booker had 3 jabs, according to him. You know, who knows what the fuck truth is? He had 3 jabs and still ended up catching the Modelo 19. He gonna sit up here and say, oh, thank goodness I got it. Because if I didn't, I'd probably end up in the hospital. That'd be a lot more severe case. But you don't know that shit. You don't know how your body would have responded to the Modelo 19 unless you get the Modelo 19 without being snapped. How do we know you didn't have the Modelo 19 before you got snapped? How do you know that? How do you know you didn't get it and had 0 symptoms? Maybe the Modelo 19 hokey pokey makes you present symptoms when you otherwise wouldn't have. Who the fuck knows? But they want to act like this Vaseline is some type of fucking miracle when, excuse me, if it were, there's no reason that there would be as many cases as there are in places, and hospitalizations, by the way, in hospitalizations, in places where there are fucking mandates, where people aren't allowed to not get the snap, where people aren't allowed to be non-GMO. You know what I'm saying? Where they have such a high rate of GMO people. You have such a high rate of GMO people, yet you have some of the highest rates of people with the Modelo 19. But Joey B's not going to explain that. He's not going to tell the truth. He's not going to say, you know, this oh my God variant is a weaker variant, and it's weaker in those who have the Vaseline, weaker in those who doesn't have the Vaseline. So we're not going to sit up here and panic. You know what I'm saying? Live your life. This is what a true leader would say. A true leader is about freedom. A true leader is about free will. A true leader is about allowing people to make their own decisions, as long as those decisions don't affect others in a negative fashion, in a negative way, right? That's what true leaders do. But we're talking about Joey B here. If he was a true leader, what he would do when he addressed the nation, he would say, you know what? I know I know it's winter. You know what I'm saying? Today marks the first day of winter. It's the transition. You know what I'm saying? The longest night of the year. It's the solstice. Take this opportunity to meditate. You know, take this opportunity to get some good sleep. And, you know, that melatonin, it helps with it helps fight the Modelo 19. There are things you can do to reduce your chance of having severe illness if you catch the Modelo 19. By the way, infection does not mean illness. You understand? Being infected with the Modelo 19 does not equal illness. It doesn't have to. Take care of yourself. Go out there and exercise. Get that vitamin D in. If you live in the northern hemisphere and you don't get a lot of sunlight, supplement your vitamin D. Take zinc. Zinc is very crucial in fighting this thing. Eat right. Lay off the sugar. Don't eat so much sugar. Sugar feeds disease. Sugar feeds cancer. Sugar is a problem. So reduce the amount of sugar you take into your body. And by the way, we have this Vaseline, and it's there and available. It's free for those individuals who want to take the Vaseline. It's especially if you're immunocompromised, you have comorbidities, you might want to think about taking the Vaseline. But it's your choice. This is a world where human beings have choices to do what they want. And for those of you who are non-GMO, hey, more power to you. If you don't want to get the Vaseline, don't get the Vaseline. The likelihood of you dying is very small. So, this is just about mitigating symptoms. This is just about reducing your chance of hospitalizations. But if you're a healthy individual, if you're young, if you're vibrant, then you might not need the Vaseline. And we're not going to push it. We're not going to force you to take it. It is what it is. Come on, man. That's all he needed to say yesterday, right? Or something like that. You don't sit up here and tell members, people that you're supposed to serve, right? Because you're a public servant, right? You don't sit up here and tell them they're going to die because they refuse to do something you want them to do. That just shows how much of a piece of shit this guy is. And really, it's no surprise because we're talking about a government official. We're talking about a member of the government pushing agendas. And the agenda is, for whatever reason, we don't know yet, he wants as many people as possible to get this Vaseline. That's what they want. They want as many people as possible to be injected with this stuff. And they're pushing so hard. It's like they're desperate. They're desperate for people to get this thing. And if it really worked, if it was effective, if it was as safe as they were claiming it was, then they wouldn't need to do that. As a matter of fact, there's this doctor, I forgot his name. He was talking about how Rochelle Walensky went on, I think, CNN or CBS, and said there's nothing to indicate that there is a problem for children 5 to 11 who get the Vaseline. There's nothing to indicate that. But then the CDC puts out a publication or a report that shows that there are problems for children 5 to 11. There are some reports, and there are also reports for children ages 12 to 47, as far as the myocarditis and the pericarditis. I mean, she sat up there and lied to the news, but then the CDC puts out the information that proves she is a liar. But that's what these people do. They lie, they cheat, they steal, they murder, they maim, and they destroy, because they are government. And that's just what it is. The government is not good for you. The government is not your servant. You understand what I'm saying? It's the government. The government is an entity that you pay to exist, that rules over you. Make it make sense. Anyway, like, share, subscribe, holla at your boy. And let's keep marching forward toward freedom. Peace.